I think first we have to be aware that there's no one single form of tinnitus, but there are different forms of tinnitus. It's happening that people experience some tinnitus without any distress, without any impact on their life. We see other patients who have from the very beginning a high impact of their tinnitus on their life. So in every situation I would first recommend to see a medical doctor, an ENT or an audiologist or both, in order to assess the hearing function. The extreme importance is, even if the tinnitus is not generated directly by the ear, as I mentioned before, if there's a problem in the ear, then this can generate tinnitus. And in some cases, it's possible to fix the problem in the ear and the tinnitus disappears. So I think the first way should always be to see the ENT doctor, see the audiologist. In case that the ear is normal and further diagnosis reveals that there are no other underlying causes of tinnitus, the moment frequently the ENT doctors tell the patients, you know, you have to live with your tinnitus, there's nothing which can be done. And I think the most important information is this is not true. What is true is in these cases the hearing is normal or the hearing cannot be directly improved. If the hearing can be improved, either by a specific treatment or by a hearing aid, this should be done. Even if the patient is not disturbed by the hearing problem. We know that people say, oh, my hearing is okay, but you find some deficit in hearing. And it's worth to try to compensate this with a hearing aid. And I think the other important thing is that it's not true that nothing can be done. We know that we have very efficient methods in order to reduce the suffering of tinnitus, in order to help to get habituated to tinnitus. And the specific treatment depends on the specific situations of the patients. It depends on the exact diagnosis and the exact situation. But I think it's important to point out that there's always hope, and we see that in almost all tinnitus patients, over time, the tinnitus-related distress gets much better, and it happens to be that patients continue to perceive some sound, but they are not distressed by the sound anymore so much, at least much less than in the beginning.